A client asks how long she and her husband can safely continue sexual activity during pregnancy. How should the nurse respond? A disabled school-age child whose parents are overprotective may display which characteristics? Webster page WND. The nurse is assessing a pregnant woman. Which signs or symptoms indicate a hydatidiform mole? The nurse is assessing a pregnant woman. Which signs or symptoms indicate a hydatidiform mole? The nurse knows that the physician has ordered the liquid form of the drug chlorpromazine, thorazine, rather than the tablet form because the liquid. The nurse knows that the physician has ordered the liquid form of the drug chlorpromazine. The nurse knows that the physician has ordered the liquid form of the drug chlorpromazine, thorazine, rather than the tablet form because the liquid. The nurse knows that the physician has ordered the liquid form of the drug chlorpromazine, thorazine, rather than the tablet form because the liquid. The nurse knows that the physician has ordered the liquid form of the drug chlorpromazine, thorazine, rather than the tablet. No next text. No next text. The nurse knows that the physician has ordered the liquid form of the drug chlorpromazine, thorazine, rather than the tablet form because the liquid. The nurse knows that the physician has ordered the liquid form of the drug chlorpromazine, thorazine, rather. No previous text. No previous text. No next text. The nurse knows that the physician has ordered the liquid form of the drug chlorpromazine, thorazine, rather than the tablet form because the liquid. Rationales: during an acute attack, wheezing may stop and breath sounds become inaudible because the airways are so swollen that air can't get through. If the attack is over and swelling has decreased, there would be no more wheezing and less emergent concern. Crackles don't replace wheezes during an acute asthma attack. Nursing process step: assessment client needs category, physiological integrity client needs subcategory, physiological adaptation. A teenager was driving a car that slipped off an icy road, killing 2 of his friends. He repeatedly tells the nurse that he should be dead instead of his friends. The client's behavior is an example of rationales. Individuals who survive a traumatic experience in which others have died commonly report powerful feelings of guilt that they survived and others didn't. This guilt is referred to as survivor's guilt. In denial, a person refuses to accept that a situation or feeling exists. Anticipatory grief occurs when an individual experiences grief before a loss occurs. In repression, an individual involuntarily blocks an unpleasant experience, memory, or feeling from consciousness. Nursing process step: analysis client needs category, psychosocial integrity client. A client is to be discharged with a prescription for an analgesic that is a controlled substance. During discharge teaching, the nurse should explain that the client must fill this prescription how soon after the date on which it was written. Rationales: in most cases, an outpatient must fill a prescription for a controlled substance within 6 months of the date on which the prescription was written. A client has a soft wrist safety device. Which assessment finding should the nurse consider abnormal? Rationales: a safety device on the wrist may impair circulation and restrict blood supply to body tissues. Therefore, the nurse should assess the client for signs of impaired circulation, such as cool, pale fingers. A palpable radial or ulnar pulse and pink nail beds are normal findings. Nursing process step: assessment client needs category, safe, effective care environment. A mother comes to the clinic with her 5-year-old son who's complaining of a fever and sore throat. The nurse documents the client's tonsils as 3+. This means they're rationales. Tonsils that touch the uvula are rated 3+. Tonsils barely visible outside the tonsillar pillar are rated 1+. Tonsils between the tonsillar pillar and the uvula are rated 2+. Tonsils that touch each other are given a 4+ rating. Nursing process step: assessment client needs category, physiological integrity client needs sub. The nurse is preparing a client for chemotherapy to treat colon cancer. The client says, "I don't know about this treatment. After everything is said and done, it may not do a bit of good. This thing may get me anyway." Which response by the nurse would be most therapeutic? Rationales. By rephrasing the client's statement and focusing on the client's concerns, the nurse encourages further discussion of feelings. Telling the client to keep a positive attitude incorrectly implies that the nurse knows how to deal with the situation best. Saying that cancer of the colon may be cured ignores the client's feelings. Mentioning that everyone with cancer worries overlooks the uniqueness of the client's feelings and implies that these feelings aren't acceptable. A 10-year-old girl visits the clinic for a checkup before entering school. The child's mother questions the nurse about what to expect of her daughter's growth and development at this stage. Which response is most appropriate? A 10-year-old girl visits the clinic for a checkup before entering school. The child's A 10-year-old girl visits the clinic for a Rationales. 4 weeks after an MI, a client's walking program should aim for a goal of 2 miles in less than 1 hour. Walking 4 miles in 1 hour is excessive and may induce another MI by increasing the heart's oxygen demands. Therefore, this client requires appropriate exercise guidelines and precautions. The other options indicate understanding of the cardiac rehabilitation program. For example, the client should reduce stress, which speeds the heart rate and thus increases myocardial oxygen demands. Reducing dietary fat and cholesterol intake helps lower the risk of atherosclerosis. A sudden rise in the heart rate while at rest warrants emergency medical attention because it may signal a life-threatening arrhythmia and increase myocardial oxygen demands. Nursing process step. A client has just been diagnosed with early glaucoma. During a teaching session, the nurse should Rationales. Eye drop installation. A client in a behavioral health facility receives a 30-minute psychotherapy session and the provider bills for a 50-minute session. Under the False Claims Act, such illegal behavior is known as Rationales. Upcoding is the practice of using a current procedure terminology code that is reimbursed at a higher rate than the code for the service actually provided. Unbundling, overbilling, and misrepresentation aren't the terms used for this illegal practice. Nursing process step, implementation client needs category, safe, effective care environment client needs subcategory, management of care cognitive level. Webster page WND. Webster page WND. Webster. Webster page WND. A child, age 5, is to receive potassium added to the IV fluid. Before initiating this therapy, the nurse first should Rationales. Potassium shouldn't be added to the IV fluid until the child regains adequate kidney function, as indicated by balanced fluid intake and output and certain diagnostic test results. The other options aren't related to potassium administration. Which medication should the nurse expect to administer to a client with constipation? Rationales. Docusate sodium, a laxative, is used to treat constipation. It softens the stool by stimulating the secretion of intestinal fluid into the stool. Lorazepam, an anti-anxiety agent, has no laxative effect. The client reports recent onset of chest pain that occurs sporadically with exertion. The client also has fatigue and mild ankle swelling, which is most pronounced at the end of the day. The nurse A client reports recent onset of chest pain that occurs sporadically with exertion. The client also has fatigue. A client reports recent onset of chest pain that occurs sporadically with exertion. The client also has fatigue and mild ankle swelling, which is most pronounced at the end of the day. The nurse suspects a cardiovascular disorder. When exploring the chief complaint, the nurse should find out if the client has any other common cardiovascular symptoms, such as rationales. Common signs and symptoms of cardiovascular dysfunction include shortness of breath, chest pain, dyspnea, palpitations, fainting, fatigue, and peripheral edema. Insomnia seldom indicates a cardiovascular problem. Although irritability may occur if cardiovascular dysfunction leads to cerebral oxygen deprivation, this symptom more commonly reflects a respiratory or neurologic dysfunction. Lower substernal abdominal pain occurs with some GI disorders. While preparing to discharge a 9-month-old infant who's recovering from gastroenteritis and dehydration, the nurse teaches the parents about their infant's dietary and fluid requirements. The nurse should include which other topic in the teaching session. Rationales. The nurse always should reinforce safety guidelines when teaching parents how to care for their child. By giving anticipatory guidance, the nurse can help prevent many accidental injuries. For parents of a 9-month-old infant, it's too early to discuss nursery schools or toilet training. Because surgery isn't used to treat gastroenteritis, this topic is inappropriate. Nursing process. A toddler is brought to the emergency department with sudden onset of abdominal pain, vomiting, and stools that look like red currant jelly. To confirm intussusception, the suspected cause of these findings, the nurse expects the physician to order rationales. A barium enema commonly is used to confirm and correct intussusception. Performing a suprapubic aspiration or inserting an NG tube or an rationales. A barium enema commonly is used to confirm and correct intussusception. Performing a suprapubic aspiration or inserting an NG tube or an indwelling urinary catheter wouldn't help diagnose or treat this disorder. Nursing process step. Implementation client needs category. Physiological integrity client needs subcategory. Reduction of risk potential. The nurse is performing a painless, non-invasive procedure to measure SAO2. What procedure is it? Rationales. Pulse oximetry is a non-invasive procedure used to measure SAO2 in which a small sensor is positioned over a pulsating vascular bed. It can be used during transport and causes the client no discomfort. An incentive spirometer is used to assist the client with deep breathing after surgery. ABGs can measure SAO2, but this is an invasive procedure. When palpating the bladder of an adult client, the nurse should identify which finding as normal. Rationales. Ophthalmic ointment is best instilled in the lower conjunctival sac. Eye drops are instilled in the sclera, upper conjunctival sac, or outer canthus. Nursing process step. Implementation client needs category. A client is in the bathroom when the nurse enters to give a prescribed medication. What should the nurse do? Rationales: the nurse should return shortly to the client's room and remain there until the client takes the medication to verify that it was taken as directed. The nurse should never leave medication at the client's bedside. Nursing process step, implementation. The nurse is providing breast cancer education at a community facility. The American Cancer Society recommends that women get mammograms. Rationales: the American Cancer Society recommends a mammogram yearly for women over age 40. The other statements are incorrect. It's recommended that women between ages 20 and 40 have a professional breast examination, not a mammogram, every 3 years. Nursing process step, planning client needs category. To ensure that the breastfeeding neonate's weight loss remains within the expected parameter of 5% to 10%, the nurse should initially establish which of the following types of feeding schedules. Rationales: breastfeeding schedules should respond to the demands of the neonate, at a minimum of every 4 hours. A neonate may not be hungry or willing to eat every 2 hours. Every 4 hours may be too long for the neonate. Using supplementary bottles may interfere with the mother's milk production and cause nipple confusion. Nursing process step, planning client needs category. The nurse is assisting with a circumcision. After the physician has started the procedure, the nurse reviews the neonate's medical record and notices that an informed consent form hasn't been signed. What should the nurse do? Rationales: parents have the legal right to decide whether their son is circumcised. The nurse and physician should always check the medical record for a signed informed consent form before beginning any procedure. A client is experiencing an early postpartum hemorrhage. Which action would be inappropriate? Rationales: by the time the client is hemorrhaging, a pad count is no longer appropriate. Inserting an indwelling urinary catheter eliminates the possibility that a full bladder may be contributing to the hemorrhage. Fundal massage is appropriate to ensure that the uterus is well contracted, and oxytocics may be ordered to promote sustained uterine contraction. Webster page WND. Rationales: first-degree AV block is a conduction disturbance in which electrical impulses flow normally from the sinoatrial SA node through the atria, but are delayed at the AV node. Nursing process step. The son of a client with Alzheimer's disease reports feeling guilty because, at times, he wishes his father would die. What is the nurse's best response? Rationales: the response in option 2 directly addresses the son's feelings and encourages talking about them. The other responses aren't therapeutic. Option 1 is a cliché, it doesn't consider this particular man's situation. Option may increase the son's guilt. Option 4 suggests that the son's feelings aren't valid. Nursing process step, implementation. A pregnant client arrives at the healthcare facility, stating that her bed linens were wet when she woke up this morning. She says no fluid is leaking but complains of mild abdominal cramps and lower back discomfort. Vaginal examination reveals cervical dilation of 3 cm, 100% effacement, and positive firming. Based on these findings, the nurse concludes that the client is in which phase? Rationales: the latent phase of the first stage of labor is associated with irregular, short, mild contractions, cervical dilation of 3 to 4 cm, and abdominal cramps or lower back discomfort. During the active phase, the cervix dilates to 7 cm and moderately intense contractions of 40 to 50 seconds duration occur every 2 to 5 minutes. Fetal descent continues throughout the active phase and into the transitional phase, when the cervix dilates from 8 to 10 cm and intense contractions of 45 to 60 seconds duration occur every 1/2 to 2 minutes. The first stage of labor doesn't include an expulsive phase. A client with refractory angina is scheduled for a percutaneous transluminal coronary angioplasty, PTCA. The cardiologist orders an infusion of abciximab, Rio Pro. Before beginning the infusion, the nurse should ensure the client has rationales. Clients undergoing PTCA receive abciximab because it inhibits platelet aggregation and, thereby, reduces cardiac ischemic complications. Before abciximab is administered, the client should have an up-to-date PTT result available. The drug isn't contraindicated in clients with a seizure history. Abciximab isn't an opioid, therefore, an opioid antagonist doesn't need to be at the bedside. Any client with refractory angina should be on continuous ECG monitoring, however, monitoring isn't a requirement for administering abciximab. An 18-month-old boy is admitted to the pediatric unit with a diagnosis of celiac disease. What finding would the nurse expect in this child? Rationales: a child with celiac disease has a protuberant abdomen due to the presence of fat, bulky stools, undigested food, and flatus. A concave abdomen, bulges in the groin area, and a palpable abdominal mass aren't associated with celiac disease. Nursing process step, assessment client needs category, physiologic. A toddler is hospitalized with multiple injuries. Although the parent states that the child fell down the stairs, the child's history and physical findings suggest abuse as the cause of the injuries. What should the nurse do first? Rationales: the nurse is required by law to report all incidents of suspected child abuse. Once the appropriate authorities have been notified, the child can be placed under protective custody. Later, the nurse may need to prepare the child for foster care placement and refer the parent to a support group. After reporting suspected abuse, the nurse should allow the parent to visit and help care for the child. During these visits, the nurse should exhibit and reinforce positive parenting behaviors. At 39 weeks gestation, a pregnant client is admitted to the labor and delivery area in active labor. During the admission interview, she reports that her membranes haven't ruptured. Her history reveals that this is her third pregnancy. She previously experienced a stillbirth at 38 weeks gestation, and she has one child at home. Which of these findings indicates the need for electronic fetal monitoring, EFM? Rationales. Previous stillbirth is one of several maternal factors that indicate the need for EFM. Other indications for EFM include certain fetal factors, such as meconium staining, certain pregnancy factors, such as amnionitis, and certain uterine factors, such as regional anesthesia. A 15-year-old client confides in the nurse that he has been contemplating suicide. He says he has developed a specific plan to carry it out and pleads with the nurse not to tell anyone. What is the nurse's best response? Rationales. In situations in which the client is a threat to himself, the nurse can't honor confidentiality. Because this client has expressed a specific plan to commit suicide, the nurse must take immediate action to ensure his safety. A client, age 87, with major depression undergoes a sixth electroconvulsive therapy, ECT, treatment. When assessing the client immediately after ECT, the nurse expects to find rationales. ECT commonly causes transitory short and long-term memory loss and confusion, especially in geriatric clients. It rarely results in permanent short and long-term memory loss. ECT is more likely to lead to hypotension than hypertension and rarely causes hypomania. Nursing process step, assessment client needs category, The nurse should expect a 3-year-old child to be able to perform which action? Rationales. At age 3, gross motor development and refinement in eye-hand coordination enable a child to ride a tricycle. Webster page WND. A 4-year-old child is receiving dextrose 5% in water and half normal saline solution at 100 ml/hour. The nurse should suspect that the child's IV fluid intake is excessive if assessment reveals rationales. Dyspnea and other signs of respiratory distress signify fluid volume overload, which can occur quickly in a child as fluid shifts. A preschool-age child refuses to take prescribed medication. Which nursing strategy would be most appropriate? Rationales: to gain a preschooler's cooperation, the nurse should show trust and express faith in the child's ability to cooperate even with an unpleasant procedure. Hiding the medication in milk may foster mistrust. The nurse should provide simple, not detailed, explanations and should use terms the child can understand. Shaming the child is inappropriate and may lead to feelings of guilt. Nursing process. The nurse writes the following note in the client's chart: the physician is incompetent because he ordered the wrong drug dosage. This statement may lead to a charge of rationales. Libel refers to written communication that injures a person's reputation. Assault is an unjustifiable attempt or threat to touch or injure another person. Slander is oral communication that injures a person's reputation. Battery refers to touching another person unlawfully or carrying out threatened physical harm. Nursing process. A client in an acute care center lacerates her wrists. She has a history of conflicts and acting out. The client tells the nurse, "I did a good job, didn't I?" Which response would be best? Rationales. Self-mutilation is the client's way of defending herself against feelings she isn't able to express. It's important to shift focus from the mutilation and to help the client express feelings in a more acceptable manner. All other answers are judgmental. Nursing process. A client is admitted to the labor and delivery department in preterm labor. To help manage preterm labor, the nurse would expect to administer rationales. Retadrine reduces frequency and intensity of uterine contractions by stimulating B2 receptors in the uterine smooth muscle. It's the drug of choice when trying to inhibit labor. Bromocriptine, a dopamine receptor agonist and an ovulation stimulant, is used to inhibit lactation in the postpartum period. Magnesium sulfate, an anticonvulsant, is used to treat preeclampsia and eclampsia, a life-threatening form of pregnancy-induced hypertension. Betamethasone, a synthetic corticosteroid, is used to stimulate fetal pulmonary surfactant, administered to the mother. The nurse is teaching the mother of a 5-month-old infant diagnosed with bronchiolitis. Which statement by the mother indicates that teaching has been effective? Rationales. Bronchiolitis places the child at risk for developing asthma. If diagnosed and treated promptly, most infants recover from the illness and return home. Infants typically don't have recurrences of bronchiolitis. Infants diagnosed with bronchiolitis rarely require mechanical ventilation. Nursing process step, evaluation. Client needs When caring for a client who has just had a total laryngectomy, the nurse should plan to rationales. A client with a laryngectomy can't speak, but still needs to communicate. Therefore, the nurse should plan to develop an alternative communication method. After a laryngectomy, edema interferes with the ability to swallow and necessitates tube, enteral, feedings. To prevent injury to the tracheal mucosa, the nurse should deflate the tracheostomy cuff or use the minimal leak technique. To decrease ED, while receiving heparin to treat a pulmonary embolus, a client passes bright red urine. What should the nurse do first? While receiving heparin to treat a pulmonary rationales. After the baby's head is delivered, the nurse should check for the cord around the baby's neck. Which of the following factors are major components of a client's general background drug history? Rationales. General background data consist of such components as allergies, medical history, habits, socioeconomic status, lifestyle, beliefs, and sensory deficits. Urine output, gastric reflex, and bowel habits are significant only if a disease affecting these functions is present. Nursing process step. Webster page WND. A client with chronic obstructive pulmonary disease, COPD, is intubated and placed on continuous mechanical ventilation. Which equipment is most important for the nurse to keep at this client's bedside? Rationales: the client with COPD depends on mechanical ventilation for adequate tissue oxygenation. The nurse must keep a manual resuscitation bag at the bedside to ventilate and oxygenate the client in case the mechanical ventilator malfunctions. Because the client doesn't have chest tubes or a tracheostomy, keeping a water-seal chest drainage setup or a tracheostomy cleaning kit at the bedside isn't necessary. Although the nurse may keep an oxygen analyzer, pulse ox. The nurse is teaching parents how to select appropriate toys for their 10-month-old infant. Which statement by the parents indicates effective teaching? Rationales: at age 10 months, a push toy promotes development of an infant's gross and fine motor skills and aids cognitive development. A mobile provides appropriate visual stimulation for an infant up to age 4 months. After this age, a mobile may pose a danger to an infant. Rattles and brightly colored blocks promote gross and fine motor abilities in infants ages 4. Nursing assessment reveals that a client has paradoxical chest expansion. Such expansion is best described as Nursing assessment reveals that a client has paradoxical chest expansion. Such expansion is best described as Nursing assessment reveals that a client has paradoxical chest expansion. Such expansion is best described as report the suspicion to the local agency on aging. The home care nurse is visiting a 74-year-old client with Alzheimer's disease. During the visit, the nurse notes bruising on the client's upper arms, and the client is more withdrawn than normal. The client is unable to communicate effectively because of his disease progression. The nurse suspects elder abuse. What is the nurse's responsibility in this situation? Rationales: the nurse must report the suspicion to the local agency on aging within 24 hours of the visit. Options 1 and 2 go against the nurse's legal and professional obligation, which is to report suspected abuse when it occurs. The client's disease process prevents him from reporting the problem. A client with possible osteoarthritis is having X-rays performed on both knees. X-rays of an osteoarthritic joint reveal rationales: in osteoarthritis, osteophytes form in joint spaces. Narrowing of joint spaces or margins, cyst-like bony deposits in the joints, and a child, age 14, is diagnosed with scoliosis and scheduled for brace application. The mother asks the nurse how long her child will have to wear the brace. What is the nurse's best response? Rationales: most children with scoliosis must wear a brace until the spine matures, typically between ages 18 and 21. Therefore, this 14-year-old child will need to wear the brace for 4 to 7 years. Nursing process step, implementation. Which steps should the nurse follow to insert a straight urinary catheter? Rationales: option 3 describes all the vital steps for inserting a straight catheter. Option 1 is incorrect because the nurse must prepare the client and equipment before creating a sterile field. Option 2 is incorrect because the nurse put on gloves before creating a sterile field and performing the other tasks. Option 4 describes the procedure for inserting a retention catheter, rather than a straight catheter. Nursing process step, implement. The nurse has been teaching a client about a high-protein diet. The teaching is successful if the client identifies which of the following meals as high in protein. Rationales: beans, hamburger, and milk are all excellent sources of protein. The spaghetti broccoli tea choice is high in carbohydrates. The bouillon spinach soda choice provides liquid and sodium as well as some iron, vitamins, and carbohydrates. Chicken provides protein, but the chicken spinach soda combination provides less protein than the beans hamburger milk selection. Cannot read from here. Webster page WND. Webster page WND. Webster page WND. The visiting nurse is teaching a client with heart failure about taking his medications. The client requires 6 different medications that are taken at 4 different times per day. The client is confused about when to take. The visiting nurse is teaching a client with heart failure about taking his medications. Rationales: when working with a dying client and his family, the nurse uses active listening to assess their feelings, coping skills, and immediate and long-term needs. It also helps the nurse select other appropriate strategies, such as reflection and clarification. Interpretation should be used sparingly to avoid making false inferences or putting the client on the defensive. Which must be included in a medication order. Rationales: the physician's signature must be included in a medication order. Other components of a medication order include the client's full name, drug name, dosage form, dose amount, administration route, time schedule, and the date and time of the order. When percussing a client's chest, the nurse should identify which sound as a normal finding. Rationales: resonance is a normal finding on percussion of healthy lung tissue. Hyperresonance may occur on percussion of hyperinflated lungs such as in emphysema. The nurse may assess tympany when percussing over the abdomen, such as with a gastric air bubble or intestinal air. Dullness occurs over the liver, a full bladder, and a pregnant uterus. A child, age 14, is hospitalized for nutritional management and drug therapy after experiencing an acute episode of ulcerative colitis. Which nursing intervention would be appropriate? Rationales: clients with ulcerative colitis, an inflammatory bowel disorder, IBD, tolerate small, frequent meals better than a few large meals daily. Eating large amounts of food may exacerbate the abdominal distension, cramps, and nausea typically caused by IBD. Frequent meals also provide the additional calories needed to restore nutritional balance. This client doesn't lack digestive enzymes and therefore doesn't need enzyme supplementation. Antibiotics are contraindicated because they may interfere with the actions of other prescribed drugs and because ulcerative colitis isn't caused by bacteria. High-fiber foods may irritate the bowel further. Nursing process step: implementation client needs category, physiological integrity client needs subcategory. A daycare worker comes to the clinic for mild itching and rash of both hands. Contact dermatitis is initially suspected. The diagnosis is confirmed if the rash appears. Rationales: contact dermatitis is caused by exposure to a physical or chemical allergen, such as skincare products, cleaning products, and latex gloves. Initial symptoms of itching, erythema, and raised papules occur at the site of exposure and can begin within an hour of exposure. Allergic reactions tend to be red, not scaly, or flaky. Weeping, crusting lesions are also uncommon unless the reaction is severe or has been present for a long time. Excoriation is more common in skin disorders associated with a moist environment. The nurse is caring for a client with end-stage heart failure who is awaiting a heart transplant. The client tells the nurse that he thinks he's going to die before a donor heart is found. He also tells the nurse that he hasn't been attending a church but wants to talk to a priest. What action should the nurse take? Rationales: each multidisciplinary transplant team has a clergy person assigned. The nurse should contact that person and request that he visit the client. It isn't appropriate for the nurse to ask her priest to see the client. Telling the client that he has nothing to worry about because donors are typically found offers false reassurance. Webster page WND